Here's what you can expect in the first 3 days of your Invisalign treatment. Invisalign treatment is a process. It takes time to get your teeth into that position where you have a beautiful, healthy, and confident smile. There are a few things though that you can expect when you start treatment. The first thing to be aware of is that there's probably going to be some discomfort in the first couple of days. The teeth have been anchored into your bone for years and years and years, and now the plastic trays have been applied and start putting pressure on that. What that means is that you're going to experience some inflammation in those areas, and the teeth will likely be a little bit achy and a little bit sore. Now, for most people, that is an annoying level of discomfort, not a lying in bed unable to move level of discomfort. For some people, they do want to take a over-the-counter painkiller like a Tylenol to help mitigate some of those symptoms. But for most people, a bit annoying for a couple of days, and then it will slowly taper off into feeling completely normal. The second thing to consider is that it will probably take you some time to get used to the look and feel of having the aligners on your teeth. Most treatment is going to require us to put some attachments onto your teeth because that's the secret sauce to getting the teeth to move. The attachments are going to feel very, very big when you first put them on your mouth because your lips and your tongue and all of that are not used to having them in there. And it'll amplify the size. And what you may start to believe is that they're huge and everybody can see them and it's a big deal. The truth is they're not. You get a hair in your mouth, it feels like there's a huge thing in your mouth. You put these attachments in there, it's amplified even further. Now, if you give it a couple of days, you get used to having them in there, you forget that they're even in there, and you get super used to the look and the feel of the attachments and the trays. The third thing to consider is how you might change and how you sound. Now, Invisalign trays are super custom made right to your teeth, and they're only a fraction of a millimeter thick. But that change for some people can induce a little bit of a lispy sound for a little bit. That lisp is usually with the th and the f sound, but the body and the brain are pretty smart, and they can figure out how to make those changes, usually within a few hours. In worst case scenarios, some people take a couple of days to get used to it, but everyone normalizes and sound starts coming out normally pretty quickly.